Well, there's many things. Obviously the newer technologies, constantly new technologies are coming in and allowing us to do things less invasively. Understand the disease and treat it, at the level that it needs to be treated and not be radical. Like, breast surgery, radical mastectomy, whereas lumpectomy now does the job even better. Same cure rate, less problems, So just understanding the gravity of the disease more and treating it as it should be rather than just treating it broadly in the hopes of getting everything. I do parotid tumors in the salivary gland in the face that sit on the nerve that moves your face, the facial nerve. And we were doing benign tumors in the same way we were doing cancers, right? And we're using this big long incision that was great for cancers, but using the same thing to treat benign tumors. So again, like breast surgery. We were doing radical mastectomies on everyone where a lumpectomy could do the job. So over the years, I've been able to innovate that, make the incisions smaller and more hidden around the ear and be less invasive so the patients have an easier time recovering from it, don't have any signs of having had surgery. Their face is, everything, protect the facial nerve and make things move. And the beauty of that is I went to Guatemala on a medical mission and I was able to do that for the people of Guatemala, the indigenous population that came in and they had like the latest, most advanced surgery that's not so available even in America.